insurance company says, sorry, we're not covering your expensive cancer treatments. We're not covering your expensive treatments for MS. We're not covering what you need.
At least Bernie's being honest here and saying how he's going to pay for this and that taxes are going to go up. And I'm sorry, Elizabeth, but you have not said that. And I think we owe it to the American people to tell them where we're going to send the invoice. I believe the best and boldest idea here is to not trash Obamacare, but to do exactly what Barack Obama wanted to do from the beginning, and that's have a public option that would bring down the cost of the premium and expand the number of people covered and take on the pharmaceutical companies. That is what we should be doing instead of kicking 149 million people off their insurance in 4 years. And I'm tired of hearing, whenever I say these things, oh, it's Republican talking points. You are making Republican talking points right now in this room by coming out for a plan that's going to do that. I think there is a better way that is bold, that will cover more people, and it's the one we should get behind.
Senator Warren.
You know, I didn't spend most of my time in Washington. I spent most of my time studying one basic question, and that is why hardworking people go broke. And one of the principal reasons for that is the cost of health care. And back when I was studying it, 2 out of every 3 families that ended up in bankruptcy after a serious medical problem had health insurance. The problem we've got right now is the overall cost of health care. And look, you can try to spin this any way you want. I've spent my entire life on working on how America's middle class has been hollowed out and how we fight back. I put out nearly 50 plans on how we can fight back and how we can rebuild an America that works. And a part of that is we've got to stop Americans from going bankrupt over health care.
Senator Klobuchar, do you want to respond?
Yes, I do. And I appreciate Elizabeth's work. But again, the difference between a plan and a pipe dream is something that you can actually get done. And we can get this public option done, and we can take on the pharmaceutical companies and bring down the prices. But what really bothers me about this discussion, which we've had so many times, is that we don't talk about the things that I'm hearing about from regular Americans. That is long-term care. We are seeing, I once called it a silver tsunami, the aging, and then someone told me that was too negative, so I call it the silver surge. The aging of the population. We need to make it easier to get long-term care insurance and strengthen Medicaid. In this state, the state of Ohio, that has been hit by the opioid epidemic, we need to take on those pharma companies and make them pay for the addictions that they have caused and the people that they have killed.
Thank you, Senator.
Those are the issues that I hear about when I'm in Toledo.
Vice President Biden.
I'd like to be heard.
Let me